UN report highlights critical challenges in the fight against HIV/AIDS by Satori News. In a sobering report released by UNAIDS, the United Nations has highlighted the persistent and pressing challenges the world faces in combating HIV/AIDS. The report, launched at the start of an international AIDS conference, paints a grim picture of the status quo and the path ahead towards ending the global AIDS pandemic. The numbers are daunting. The UN asserts that nearly 40 million people carried the HIV virus in 2023, and alarmingly, over 9 million of these individuals were not receiving treatment. This treatment deficit has translated into devastating loss, with a staggering statistic that every minute someone succumbs to AIDS-related causes. Despite significant progress over the years, evidenced by a substantial decrease in AIDS-related deaths from 2.1 million in 2004 to approximately 630,000 in 2023, the figures today still dwarf the ambitious target for 2025, which aims for fewer than 250,000 such deaths annually. UNAIDS's report reveals that progress has not only plateaued, but is being threatened by dwindling resources and mounting new infections in key regions, particularly the Middle East and North Africa, Eastern Europe and Central Asia, and Latin America. The impact of HIV/AIDS is felt unevenly around the globe, with girls and women in parts of Africa facing shockingly high rates of infection, indicative of a broader issue of gender inequality fueling risk and vulnerability to HIV. The report also highlights a concerning trend. The percentage of new infections among marginalized communities, including sex workers, men who have sex with men, and those who inject drugs, now stands at 55%, up from 45% in 2010. These communities, facing persistent stigma and discrimination, are often neglected in prevention and treatment strategies. Winnie Byanyima, executive director of UNAIDS, calls on world leaders to fulfill their commitment to eliminate AIDS as a public health threat by 2030. This ambitious goal can only be achieved through adequate funding and a concerted effort to protect human rights across all communities. Although current treatment strategies largely rely on daily pill regimens, cost-effective at roughly $75 per person annually, innovations in treatments, including biannual injections, show promise. However, with a prohibitive price tag of $40,000 a year, access remains limited to the wealthiest. UNAIDS is actively advocating for these treatments to be made affordable and accessible, especially in low and middle-income countries. With existing knowledge and glimpses of future possibilities, as demonstrated by a handful of individuals emerging HIV-free after leukemia treatments, there is hope in the horizon. Nevertheless, it's clear that the success in eradicating AIDS hinges on global solidarity, financial commitment, and equitable healthcare access. Ongoing advocacy for an AIDS vaccine is among the efforts UNAIDS continues to pledge as the international community grapples with current treatment challenges and explores future preventative measures. Thank you for choosing Satori News.